Good morning, everyone. Today we're going to be talking about the ailing healthcare system in America and within different companies in America. And since the November 8th, 2016 election, when we elected President Donald Trump as our president, he has been faced with tackling on our ailing healthcare system and how to make it better since Obamacare has been so unaffordable to many millions of Americans. So if we jump to PowerPoint slide number 2, we'll see on March 24th, 2017, President Trump issued a mandatory vote on his Trump Care plan, which ultimately failed and did not win enough votes and was denied. So what is his Trump Care plan proposing? Well, number 1, he wants to allow young adults to stay on their parents' plans. Number 2, he wants to cover fewer people than those who gain insurance under Obamacare. Number 3, those who let their insurance coverage lapse will see their premiums increase by 30%. And he also wants to block federal payments to women's health care provider Planned Parenthood, where women can seek free birth control. So on the British Broadcasting Corporation, formerly known as BBC News, in 2017, they discovered that currently there are 40 million Americans that are uninsured, and by 2026, there will be 52 million Americans uninsured. On April 7th, 2017, Donald Trump casted another vote within the House of Representatives about his Trump Care plan, which he again redesigned because the first time it failed. Ultimately, he was turned down again. So how are uninsured Americans struggling? Well, let's jump to PowerPoint slide number 3 and talk about Sherry Gliad, who has a PhD and is the head of the division in policy at Columbia University. So she said, "We got here because employers and insurance agencies are trying to come up with ways to make coverage affordable for all Americans. And because our healthcare costs have until recently increased at a tremendous rate, we are no longer have second surgical opinion programs. And because premium rates started to increase higher and higher, ultimately more Americans were not able to afford health insurance." So let's look at the image that we have on PowerPoint slide number 3, where it states in 2011 that family health care costs were $19,393 for a family of 4 or 5. That is a whopping price. So we want to see how other Americans have struggled. So let's talk about Cynthia Schaefer, who is a resident of Michigan, and jump to PowerPoint slide number 4. And she was interviewed in 2017 by Bridge Magazine because 5 months ago she was diagnosed with cancer and she didn't know if she would be able to afford treatments and all the screenings that had to be done for her tests. So she has stated that she has paid $900 a month for insurance, a premium payment of $550 a month, and a whopping $10,000 deductible before her insurance can even kick in. So what's the problem with her insurance? She has a $10,000 deductible that is hard to be met, and Americans with a $3,000 deductible or even less have a hard time meeting their deductibles. So let's jump to PowerPoint slide number 5, where we talk about the health savings account. Well, there was a study done by the Employee Benefit Research Institution in 2017 where it stated 87% of employees say employer-based health insurance is extremely important to them. So if we look at the workplace evidence, we can see that 42% of employees say they want their employers to continue paying for their benefits, 20% prefer to turn toward a system where their employer provides their employees with money that they would be able to spend on benefits, and employees say they would prefer to use that money that their employers give them to decide on their own health insurance plan that they feel is perfect. So an HSA account is a tax-advanced medical savings account available to taxpayers in the United States who are enrolled in a high-deductible health plan. So this means allowing Medicare to negotiate prescription prices would save the United States $300 billion a year in spending, which in 2014 we spent on U.S. drug spending. So what are some solutions? So let's turn to PowerPoint slide number 6 and talk about the many Americans who already continue to use their HSA accounts. And most employers only offer one source of healthcare provider for their employees. So what if we offered different types of accounts like HSA accounts or the employers who continue to pay for their employee benefits can continue paying as they please. And so the employee benefit research in 2017 said there's 88% of HSA enrollees who continued in 2015 with an HSA plan. And so employers who do not offer HSA accounts or equivalent need to broaden their horizons and offer more than one plan, because ultimately they're going to start losing employees, or they're not going to be able to get employees into their office because of the benefit program that they provide. So again, we have an ailing system in America within our healthcare system, and we need to do something about it.